everybody. Dr. Leo Krawetz, Healthy Feet Podiatry. Got a great patient here. She had some bone spurs removed from her toe. I think it was a spur, right?
I don't know what it was.
Yeah, it sounds like a bone spur. So it sounds like she had a bone spur underneath her toenail. This was like probably 15 years ago, and she noticed it started getting puffy again. It's not really the spur. Take a look at this right here. It looks like it's most likely the ingrown nail on the side. So right here is where it got puffy. It's harder to see because there's betadine on there. It's a little red there, a little bit irritated, but I'm pushing on it and I do feel a little something there. We're gonna see if there's a little surprise in there when we take the nail out. But if you look at the nail is going straight down. It's an ingrown nail. So we know that this side's definitely a problem because she's getting pain all along the side. But she also told me that she's been cutting this out herself too. And she's been cutting the tip of the nail off. And you can film me if you want to. We've got like 2 cameras going now. So, but she's been cutting the tip of this off too.
And this has been a problem.
It's right here?
It's like, it starts down here. And then it's here. And then I lift this up. And then I like.
And she's cutting it, yeah.
I do my own procedure.
So we're gonna take that side out too. So we're gonna do both sides of the nail. She's gonna have a narrower nail. It'll be like this when it's done.
So it's not. Can you make it so I have as
much
nice
nail as possible? Yes, that's what we will do.
I just don't want it to look like.
Yep, and we get asked that all the time to take just as little as possible. So what we do is we watch the leading edge. I see how far can I really go. So I look at this skin, and you see where the skin comes up to the nail right there. I know that when there's a gap there, it's going to move over this way. So I can literally go right here is the edge where it starts to head downward. I can go about halfway between there to take out the nail, and that's what I'm going to do.
I think I might want to not do that until that's done.
You don't want to do this side?
I think I better just do this side and then wait how that.
That's no problem. Okay. So we can do that too because there's a chance that when we take this side out, that as the nail grows out, it's going to grow out and sort of angle a little bit like that and maybe take the pressure away from there.
Okay.
We can always go back and do it again.
Steps,
yeah. That's no problem. Yep. So that's what we'll do. So there we got a quick change here already of what we're doing. No, that's totally fine. I'm glad you told me before we took it out. So what I'm doing is I'm going to show you this. Watch this spatula. And as I go down, you can see how this turns and goes downward. And this is the edge that I'm talking about that's going downward. I'm going to go halfway between right here. So first I'm going to loosen up. You okay?
Yeah.
Okay. No pain, right?
No.
Okay. I can actually feel the scarring right there. Yep. She's holding my assistant. So if you hear anyone scream, it's my assistant because her arm is getting squeezed so hard right now. Okay.
We bonded before she
No
got
pain,
here.
right?
Before you got here.
Okay. Oh, good.
So it doesn't hurt.
Yep. So that's
right,
it.
So this isn't gonna hurt.
No, you won't hurt at all.
All right.
That's it.
You'll feel good.
Yeah, you can still grab her arm and squeeze it really hard. Yeah, she needs to be punished for last
she
week.
need to be punished?
I'm just kidding.
She can do her job.
She's laughing. No, Michelle's good.
It doesn't
We don't
hurt.
need to
I thought it was
punish
gonna
Michelle.
hurt.
Nope. So it's bleeding a little bit right now. So what I'm doing is I'm going under the nail right now, under the side edge, and I'm going to actually go under. This is actually tight here. And it's probably because she had bone surgery here. So there's a lot of scarring under here. So I'm all the way back. Oh, that's good that it's even bloodier than we thought here. But you know what? I am going to. You know what? We're going to put this tourniquet on. And that's going to make a big difference here. We were talking so much, we didn't put the tourniquet on first, but I'm gonna exsanguinate this too. This will push everything out. Do this real quickly here so we don't have to worry.
I thought it was gonna hurt, but it doesn't hurt at all.
No, you don't feel this. You don't have to feel a thing. Okay, let's get this out. And you'll see. Always better with the tourniquet. And let's clean this off.
The worst part of the whole thing is the shot in the beginning.
Yeah.
Okay, we're gonna make it now so we can actually see it better too. So I want to show everybody something too. Okay, so now we don't have as much bleeding. And I'm gonna show you what I took off. If you look at this nail, hold on here, did we clip that? Hold on. Let me go back and make sure this is freed up here. There it is. Okay. Okay. Now we can see it better. So we look at the nail. This piece of nail is real far down here that I got out. There we go. See it? That little edge right there. We're only taking part of it. This is so she has minimal nail out. So I'm under the epidicum. It's crazy because you got a lot of scarring under there from where that you had that. You can already see it's already popping out over there. Most of the problem is right here. See this edge right there that I'm pulling? This is the most satisfying part of the procedure where you can actually see the skin and the part that's digging in come out. Do you see all that stuff right there? Are you able to see it up there? It's all the tissue that's built up. See that? Look at that. We're going to show it everybody that's watching. That's the chunk of nail. And I only took a small sliver, but if you look, that was cutting into the side of her toe, and it caused enough callus tissue that I was able to pull that callus tissue off of there. Now back here, I want to make sure that all this is out. This is where she has the scarring from where the other doctor took out some bone spurring. And I'm going to feel back here to make sure. This feels different than most of these ingrown nails. It actually feels rougher, and that scarring that's under there. So I'm going to make sure that we burn that nail matrix, and that's where the nail grows from. And this is the chemical that we put here. Can you see that up there? Pretty cool, huh? Yeah. Live nail surgery. This is better than watching it on YouTube, right? Yeah. Actually, you know what? When you watch it on a big screen, it's kind of cool because it's huge.
I'm just glad I don't feel anything.
Yeah. So those of you watching it on a big screen right now, I want you to say, this is really cool up close. This small piece looks really big. But it is really cool to see on a big screen because you can actually see all the detail of everything that's going on. So that's one stick. We usually do 3 10-second sticks here, and that's to kill the area where the nail grew from. To me, this is interesting because I'm feeling underneath here, and I'm right. This is the area that was puffy. See how I'm pushing this up? And it's actually, this is all just scar tissue. You have a lot of scar tissue there from where the other doctor, I'm not going to mention the name, did the previous surgery there. It's scarred up. So there isn't much you can do about that. We could cut that out and do like a skin plasty, but it wouldn't be worth it because then you could scar again. So at this point, we're just going to, you should be fine because that wasn't hurting you anyway, was it? It was more just the side of the toenail. Okay.
So you just can't pop that out?
What's that? No, you can't pop. There's nothing to pop out. No, you have to cut it. You actually have to.
That's what he did, though. He cut it out.
Yeah, no, I'd have to do it. You'd have to do a whole skin cut where we'd have to take a wedge of skin and then sew it back up again. Then you run the risk of more scarring.
Because it was actually scarred from an injury.
Yep.
Something fell on the toe.
So there is the possibility, and we're not going to know for about 2 months after it heals in, that once it heals in, because no nail is going to be under there, that it may actually start to, the hypertrophy there, the hypertrophic tissue, which is thickened tissue, will actually thin out and go down because there's nothing pushing from underneath. Did we sense a smoker's cough up there?
A little bit.
Our camera person?
Sorry.
Oh, it's okay. Oh, careful. Okay.
Yeah, but that didn't seem to cause any pain, so.
Okay. Yeah, I mean, I don't think it will. And that's the whole thing. If it didn't cause pain, it's not going to cause pain now. Yeah. So the good thing is it's probably, I bet you it goes down a little bit because there's nothing pushing from underneath up top. So, but you do, once you get scarring, it's scarred. You know, your body remodels itself like that. So, and that's what happens, unfortunately, when your body remodels. Sometimes it puts down too much extra tissue and then you get a lump, a little bit of a lump there. But the good news is it doesn't hurt you. Okay, this is our betadine. And we're going to just cover this thing up. Oh, you know, let's do the adaptic since we have it here. Michelle got adaptic out for me. So what we're going to do is put some betadine soaked adaptic on there. Adaptic is non-adherent dressing. So we put this over there because sometimes when it bleeds and you put gauze on there, it sticks and people are scared to pull it off. Yeah. So people are scared to pull it off and then we get that phone call. Oh my God, I can't get the bandage off. And they're afraid to just pull it. And really, the reality of it is you just have to go like that and pull it off of there, just like a Band-Aid. But you won't have to do that in one stick with this. So that's it. Let's wrap this up.
So it looks like it's not going to look deformed.
No, not at all. Nope, not at all. The skin's gonna move towards the nail. It's gonna look perfect. You won't even be able to tell. It'll actually probably look better than it did. So, because you probably won't have that bump anymore. You get a nice purple toe. So that's it. Another person cured forever. Her life is going to be 5 million times better without that ingrown nail. If you like what you see, subscribe to the channel. Watch Instagram, Healthy Feet Podiatry. Facebook, Healthy Feet Podiatry. We're all over the place. If you love these videos, definitely subscribe to the channel. We'll have more for you soon. Thanks.